In today's health headlines, drowning death rates have increased. The link between how loud your neighborhood is and your child's mental health, and new research on reducing peanut allergies. Joining me is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Welcome.
Hi, thanks for having me.
You bet. Accidental drowning incidents are on the rise across the country. After rates were dropping for decades, how can we stay safe as we head to the pool and the beaches this season?
So these are some sobering statistics that came out of the CDC yesterday. After 20 years of going down, for the last 2 years, these drowning deaths have been increasing to 4,000 a year. The way the CDC put it, that's almost one drowning death every 2 hours in our country. What is really sad about this is that it's particularly amongst preschool and younger age children that we see some of this increase, and amongst minority populations, those who identify as Black Americans, Hispanic Americans, and Native Americans. And so we have a lot of ways to go to make sure there's better swimming education. Almost 15% of adults in the United States still report that they don't know how to swim, and as well as sort of safe activities around the pool and limiting alcohol use and things like that if we want to reverse the trend back to the positive trajectory we used to be on.
And could cell phones have something to do with this? Adults not paying attention?
You know, there's a million different theories of what may be out there. There's a lot that we have done to make swimming safer: lifeguards, pools, swim lessons, things like that. But I do think if you're a parent out there, and I know this with my little kids, until your kids are really confident swimmers, you really got to keep a close eye on them.
Absolutely. All right, noise pollution in neighborhoods like busy traffic sounds can increase your child's risk for anxiety. What do we know about this?
This is an interesting study conducted in England where they started following kids who were born in the early 90s, now 20 years later, to look at what their exposure to pollution and noise when they were both in utero and infants and toddlers meant. And what they found was that there was more episodes of depression in mothers exposed to these environmental conditions, and that those kids had a higher likelihood of having anxiety when they grew up. It's not, direct causation. These are associations that are found, but I do think it speaks to something that we know, that the more sort of environmentally sound the environment is, both when children are growing inside a mother as well as after they're born, has a lot to do with their long-term health.
All right, and finally, a new study found that exposing babies to peanuts in infancy can significantly reduce their risk for an allergy years later. What about that?
So parents of young children know that a few years ago, pediatricians really strongly recommended introducing your kids to peanuts early in life to prevent later allergies. And that came out of this big study that was done a few years ago. Those same researchers went back to those kids and followed them up and found that just by being exposed to peanuts regularly as an infant, that protection from getting a peanut allergy lasted into adolescence, even up to 13, 14 years old. And that even if you stopped having peanuts after you're exposed as a kid, you still kept that protection from developing an allergy. And so I think it just bolsters the recommendation for early introduction of peanuts with the guidance of your pediatrician.
All right. Thank you so much, Dr. Arjun Venkatesh. Have a great day.
Thank you.